case where we've another type of disease process where we found the robot to be useful, particularly with SEEG. This is a 17-year-old with tuberous sclerosis having epilepsy over the previous 18 months, where it increased up to 10 a day. He failed medications. The video EEG was showing scattered multifocal discharges, which is very common in tuberous sclerosis. Traditionally, again, there's a number of ways to treat this. Harry Weiner has up in New York has suggested, he's now at Texas Children's Hospital, but he's written some landmark papers just describing multiple stage procedures with grids where they implant the child with the surface electrodes. They map out which tubers are the hottest. They go and they take those out, and then they put the grids back on to find out what other electrical hotspots appear once those other ones are silenced. And they may have multiple stage up to 3 stages of surgery in doing this. SEEG and visual laser ablations is really optimal for this because it's so easily repeatable and so well tolerated that you don't. If you're going to be targeting specific spots and then going back and doing multiple procedures. And so this is how we targeted this particular patient, where you can see numerous tubers, but there was a cluster of them within the right frontal lobe where it seemed to be hottest. You can see a sega on the left, which was most likely not electrically active in this patient. In this one we only had to place 4 depth electrodes to monitor these. We found out which ones were hottest. We replaced those depth electrodes with the laser catheters. You can see the shadows of the visualized laser catheters here, and then went on to ablate those portions. And three of the 4 depth electrodes, one of them was not active, and we were able to remove it. Again, everything removed in the MRI suite, and the kid was able to go home pretty soon. He did develop a temporary SMA syndrome with some mild weakness that resolved after just a few days. It did keep him in the ICU a little bit longer than what we usually see after these cases, but he was able to go home by day 5. And at 6-month follow-up, he was completely seizure-free, and they're working on weaning his antiepileptics. So that's another instance where we found SEEG to be very useful.